Hello, I'm Sulin with HBW-TV. Today, I have Mr. Nazir with me to talk about prevention. Mr. Nazir, I'm aware that H Healthcare Berhad has centres which provide health screenings. Could you tell me more about that, please?
Well, we have some executive centers that we provide health screening services, executive health screening services.
Yep.
Yeah, which is our main intention to focus this is to support patients for early detections and prevention.
How does health screening correlate to prevention or early prevention?
Well, when we talk about prevention, is not only a health screening. Okay, prevention, the word is quite wide range. I think it's starting from food, okay, what kinds of food you are taking, and diet, your diet plan. Then we talk about exercise, what kinds of exercise is suitable for you and you should do. And we talk about even sleep is parts of prevention. I mean, you do everything but you don't have enough sleep, so you can't prevent it. So I think when you talk about prevention, it's a very wide range. And one of the important elements for prevention is health screening. And for me, I always talk about not missing the test. When we talk about health screening, medical checkup, many people actually just do a common basic blood test. And when the doctor look at the report and say everything is fine, they feel very happy and comfortable. So those people, I would like to pass them a message that you actually need to do more comprehensive checkup to understand better. And when you have that report, okay, your doctor and your dietitians is actually will have more information about your health, and they can actually give you the right direction and tell you what exactly is supposed to take, which is more proper way. I mean, you have more information, and you are practicing preventive lifestyles, which is going to lead you to go for early detections and prevention.
What would you recommend is the frequency for a general medical screening?
For general medical screening, when you talk about general medical screening, there are many types actually. You can talk about 10 to 20 types. Okay, so it's general, it's always general, unless you got to be specific. It depends what kinds of general tests you wanted to do. And I think this is, doctor is the one who make decision according to your quotation or complaint, So that is under general medical checkup, yes.
So how often would you recommend the average person to book an appointment and attend their medical screenings?
Well, I strongly recommend people to go for medical screening once in a year.
Once a year.
Once in a year. So what happened is, your medical screening last year to this year, you can compare the differences to the reports and to your health. And when you see the comparisons, you can actually understand the differences, and you have dietitian and the doctors to explain to you what to improve further. Yeah, I think that's one of the best ways. So once in a year is the best.
So at what age do you recommend people start regularly attending their annual medical screenings?
Well, very good question. I mean, when you talk about health screening, I think age is going to define you, to tell you what types of tests you're supposed to do. So I think we have the range of medical screening based on the age. If you're like 18 to 25, you have one type of medical checkup. You can do like basic executive medical checkup. 25 to 38, you can do like executive kinds. Then 38 to 55, you may go for a little more advanced, more comprehensive tests, because when you are aging, you have some other complications, so you can actually look for it. So it depends on the age, what kinds of age you are in, and based on that, what types of tests you're supposed to do.
Based on that, I understand that your recommendation would be above age 18 then?
Yes, unless you have any symptoms, I think 18 is the ideal age to go for a pre-screening or some basic screening, yes.
Do you think that the Malaysian provision of medical screenings is sufficient to detect most diseases then?
It's very hard to say. okay, because we are talking about non-communicable diseases, critical illness. A lot of diseases are not communicating, you see, so we don't really can suggest patient to do certain tests, whether it's necessary or not. I think the doctor will be the best person to explain on this based on the situation and case by case.
Very true. Do you think that the Malaysian culture is very positive or negative or neutral towards the idea of committing to annual medical screenings?
Well, I think Malaysians are very flexible. They are nice, and the people who understand it, they have explanation. Okay, they're willing to go for it. But I say we still need health education. We need to improve on health education and create the awareness. We are lacking on awareness and understanding. People don't understand the common needs of the health screening, where they're supposed to go and not what kinds of tests they're supposed to do. So health education need to improve, yeah.
And do you think that Malaysia is working towards a good goal of health education? Are we on the right path?
Yes, definitely. I think the government is improving, the people is improving. There are social media to support and improve the quality of lifestyles and education, what to be done and so on. Many informations is been transmitting and transferring to the public, and I think they're accepting it, and then we can see more educated, health educated patients around. Yes.
And how does H. Berhad factor into this eventual goal?
Well, I think we started very small, and then we see we have big acceptance in the market. I mean, people really love to see us in different places. We don't really feel comfortable to let people to travel from every part of the country and come to Penang. You know, we start from Penang, so we see we have demand in Ulster, KL, Cambodia, Vietnam, and Indonesia. So that actually encourages. I mean, when you have a lot of supports and people, the public and the customers is consistently support us and encourage us to, you know, drive further. This is where we have actually the passion to continue. Yeah, I think that is what actually motivates us to move further and set a goal that we wanted to see ourselves over there.
That's wonderful, thank you. So before we wrap up, do you have any words of advice you'd like to give the public?
Yeah, I think I always talk about prevention. Prevention is better than cure, and health screening is one part of it, and you should go for health screening. Thank you.
That's wonderful, thank you so much.
You're welcome. Thank you.